Good evening, everybody. I'm Marty McCafferty. I'm one of the medics with the Dan Medical Department. A little bit on my background. I've been a paramedic for more years than I care to admit to. Worked in the field and in an emergency room. I'm also a recreational dive instructor. So I got a chance with Dan to marry both of those passions together, and it's been a real pleasure. We staff the emergency hotline 24 hours a day. Hopefully, you'll never have to talk to me, and I hope not either. But the question comes up among divers, as you'll see on the slide up here, I may be bent, now what? Well, we're going to try to tell you tonight what to do, what to expect, and more importantly, how to prevent that. All right? Now, before we get into what the problems might be and what we need to look for, I just always like to remind people, why do we do this sport? We know it's fun. We know it's a sense of adventure because we get to go places that most people don't get a chance to. We visit coral reefs or shipwrecks that most people only see on television. We also know, again, it connects us with nature. We get to be in the aquarium rather than standing on the outside of the glass looking in. And it is exciting. And yes, unfortunately, there are risks with this sport. On average, in the US and Canada, we have about 1,000 divers every year that report injuries. And unfortunately, too, and even more tragically, we have about 100 divers that die annually, again, between the US and Canada. But it's always a good idea, no matter what your level of training is as a diver, to review very quickly signs and symptoms and what the illnesses are. Divers used to spend a lot of time trying to differentiate in the field between arterial gas embolism and decompression sickness. And that's really unnecessary, because the treatment is the same. So we're trying to get people to use the term decompression illness because that covers the whole spectrum and is kind of an umbrella term. And that's important to point out. Now, the two distinct type of injuries, and again, they can be very hard to tell apart. Even the medical professionals sometimes can't tell them apart, is the arterial gas embolism, or AGE, and the other is decompression sickness, what was commonly and still known colloquially as the bends. And what we try to point out to people is, even with the advent of dive computers and other safety guidelines, you can do everything right and still, unfortunately, end up with an accident. Out of all the dives that are done every year, it's still about 1 in 40,000 divers that actually gets hurt. So even though that seems to be a high number of injuries, that's still a pretty small amount as compared to some other sports. Even though we're going to talk about signs, symptoms, how to recognize it, and what to do for it, I promise you we're not going to make you qualified to diagnose it. You're still going to recognize things. Only a physician can diagnose. The other purpose of it is to recognize it early and provide the care that you can at your level of training and experience, and to facilitate transfer to a higher level of care. That can be as simple as, hey, I got my cell phone, I'm going to call 911. Keep that in mind. Sometimes that gets forgotten in a panic. Now, to talk about the injuries more specifically, arterial gas embolism is an actual bubble that makes its way into the arterial blood supply. It can actually block arterial blood flow. Think of it very much as like a stroke, because that's how it behaves. There's usually an overexpansion injury to the lungs that was a contributing factor to that, or maybe along with that. So you've got to be mindful that that may be something that complicates it. It does make its way into the arterial bloodstream, and it travels through the heart and gets sent through the arteries. And most often it does affect the brain. That's why it more often shows up like a stroke. There are times that it can directly affect the spinal cord, but more often than not, you're going to see it affecting the brain. And what is the hallmark of this particular injury is that the symptoms show up very quickly. Within the moment of surfacing, or no more than an hour after they've surfaced, these symptoms come on, and they're usually very obvious and very hard to ignore. Decompression sickness, which is the more traditional bends, as we know, has to do with the nitrogen we've absorbed while we were submerged under the water. We know we gather more nitrogen to maintain an equilibrium with the increased pressure. Some of the factors involved with that is the excess nitrogen. We've either stayed down too long, we went deeper than we planned, so we've got more than our body can get rid of easily, or we make a rapid ascent. swimming too quickly to the surface so that your body cannot exhale that excess nitrogen. Another factor can be decreasing pressure, and you may look at me and say, Marty, exactly what does that mean? It's as simple as a change in altitude. This is part of the reason why flying after diving can be an issue, because you've got less pressure on your body than what you do at sea level. Or driving through mountains. People sometimes forget that's just as important as flying. The symptoms can be a little more delayed. They can also come on very quickly, but they can be delayed as much as 24 hours on average. If symptoms show up later than 24 hours, you have to ask about, did they have an exposure to altitude? What's always frustrating to us that man the emergency line is that truly divers call us because they have symptoms that won't go away. Quite often they've had symptoms for at least 24 hours or more before they decide to call us because, you know what, this just doesn't seem to be getting better. Often shoulder pain or joint pain is dismissed because, well, I'm sore because I was carrying tanks or I was lugging the gear or carrying luggage. You know, my computer said I didn't make any mistakes, there was no alarms, no buzzers, nothing. And well, you know, I've had this before and it got better on its own, so, you know, I don't need to worry about it. Or quite often, well, you know, the hospital's an hour away and it's just too much of a pain to drive all that far. Also, other reasons are that decompression illness can have a lot of times very subtle signs and symptoms that you may not be immediately aware of unless you're looking for them. It can also cause very minor symptoms that are easily ignored and people attribute to other things. Definitely being treated and being hospitalized is probably going to ruin that expensive dive trip and vacation. It certainly will do that. And unfortunately, very practical matter is that unless you've got proper insurance or good enough insurance, there is an expense involved with evacuation and treatment. It can get expensive. There's also still that stigma with being bent. All of us still, and I admit I'm guilty of it too. I'm guilty. Somebody ends up having a dive injury, we think, okay, they must have done something wrong. What did they do wrong? Well, truthfully, they may not have done anything wrong. And people are afraid that if they admit that they've had decompression illness, they may never be able to dive again. Well, that's not true. And yes, there is a lack of knowledge about decompression illness, and I'm hoping today I can address that at least partly for you. Here's a scary statistic. Almost 15% of the injured divers continue to dive after they had symptoms first show up. That's pretty significant and pretty scary. They come up with something from a dive that doesn't feel right, it's not normal, but they ignore it and go ahead and keep diving. 9 out of 10 times, all that's going to do is make everything worse, and it can have some serious consequences. The reason why it's so important to recognize it and seek treatment so quickly is that it does improve the chamber treatments. It improves their effectiveness. The sooner you can get treated, the more effective it's likely to be. Also, it helps the symptoms clear up more quickly. The more serious injuries can take a very long time to clear up all the symptoms. But the sooner you get treated, the better symptom resolution you have. And it also improves their chances of being able to dive again. That's something divers have to keep in mind. Don't ignore it, because if you're really afraid of not being able to dive again, the sooner you're seen and treated, the better the chances are you'll be able to get back in the water. These are the most common signs and symptoms. The one that we know from our annual reports, the most common one is pain, usually in the big joints, shoulder, elbow, even hip, knee, sometimes wrist. And it's set apart because it's a different type of pain than what people usually experience. I'm sure most of you, if you've been working in the yard or sports, something hurts. It's a different type of pain. Numbness, like if you've slept on your arm and it's completely numb afterwards, or some people describe it as, you know, they felt like they got a shot of Novocaine from the dentist in their arm. Very similar to that. The dizziness, not so much, but that vertigo. Now, does everybody understand that vertigo